Good morning, Dr. Warsh. Thanks for taking the time to chat today. I'm very excited about the conversation. Pediatrician to pediatrician. I was talking off camera before recording. Most of the conversations I've had is actually with non-pediatricians, just because seeking external education, let's say it's a mental health professional, a diabetes expert. But I think with where the world is going now, a lot of the changes and the focus on longevity, wellness, and prevention, even though it's not 3-year-olds who are buying Fitbits and wearing Oura rings, the funny thing is the habits for longevity are really rooted in pediatrics. And my dad was a pediatrician. I always tell people, when you open the newspaper or you go online and you see, skyrocketing rates of, mental health disease in adults, diabetes, life expectancy is declining, all the chronic medical problems that are draining our healthcare system are pediatric problems. And we focus on adult doctors to kind of solve the problem because that's when the problems, quote, present, which I think is a fundamental mistake. I think those problems are the outputs of either the lack of the right inputs or the wrong inputs going in early in life. And those habits, whether it's physical fitness, mental health, nutrition, diet, exercise, so on and so forth. And so I think pediatrics, and this is a biased statement, one that I'm sure you're going to concur with, pediatrics is greatly undervalued, right? And the impact it can have on a lot of the spend, right? And too often you have bureaucrats looking at P&Ls and spreadsheets and doing value-based care contracting way after the fact, instead of rewarding a system that emphasizes prevention. And so this last couple of weeks, I've been having conversations with Dr. Offit, Dr. Alok, and now with you. I'm seeking kind of the best minds that I respect, that I either have heard speak, I've read some of their content, and I think have a very unique perspective and insightful, often unorthodox perspective from a pediatric standpoint, which I think the time has come for these kinds of voices to be better heard, right? And what I like about kind of your content is it's very kind of non-dogmatic. It's rooted in science and experience, but it's open. That's how I would describe your perspective in a word. It's open. And that's a synonym for that is humble, right? Which unfortunately is lacking on both sides of any of the conversations where a lot of people are screaming and not listening. And so with that, I'd invite you to give kind of a bit of your background, your journey as a person and as a pediatrician, and how you got to where you are.
Yeah, well, I mean, first of all, thank you so much for having me on. I'm honored to be on and even be mentioned around, people like Paul Offit, which have been, in this industry for so long and have contributed so much. And I I think it's really important that doctors start to talk to each other more, especially, in pediatrics and having more conversations like this. I would agree. I've been very fortunate over the last, especially 6 months, but over the last few years to really be on a lot of shows and podcasts. And like you said, a lot of times it is with non-health practitioners or practitioners in other fields. But with everything going on, with all the controversy, with all the discussions, with all the debates, with all the frustration, I think one of the major solutions that we need to have right now is having doctors talking to each other, having open, honest discussions and debates, and really talking to people that you disagree with. I mean, I think that's fine, and you can totally disagree on, or you can totally agree on everything, but I don't always think that's super constructive. I think it's absolutely fine, and we need more of these discussions between doctors and practitioners who totally disagree on some of these issues, but do it openly so you can find some common ground. You can help parents to move forward. There's a lot of confusion out there, and I think this kind of conversation can be super helpful. I'm sure we'll agree on some things, disagree on other things. That's totally fine. And like you said, I'm very open. I don't have any specific position that I want. I'm dogmatic on this one thing. I want healthy kids. I think that's what all doctors want, and I think sometimes we can disagree on how to get there, and that's fine. But ultimately, if we had conversations instead of just social media people yelling back and forth, then we can actually get somewhere and move forward. So I really appreciate you having me on. And yeah, so for me, a little background. I'm a pediatrician. I trained at Los Angeles Children's Hospital, very Western, program, super good program for pediatrics. I wouldn't say I was particularly naturally minded as a kid. I ate pretty healthy, played sports, all that kind of stuff, but wasn't really thinking about any of that at that time. And then I didn't meet my wife in residency. She's very holistic minded. It opened up my eyes to a little bit of a different perspective, and started doing some courses and some training in functional medicine. And of course, when you're in training, anything you hear about natural medicine is kind of, oh, it's woo woo, it's out there, it's all crazy. And I did one course in functional medicine, and I went there and I was like, wow, this is really interesting. They're talking about diet and exercise and sleep, and none of it was woo woo and out there. Obviously, some stuff in integrated medicine can get way out there, but really what I was learning had nothing to do with being way out there. It was like, why weren't we taught this? Why are we thinking this way? Like, obviously, diet's important. And so that to me was really interesting. And so I did continue to learn. And I have tried to integrate that with my Western training in my practice. And so that's the way I've been practicing for the last decade or so. I'm not against Western medicine at all. We do medicine, in the office when we need it. I just try to use it as minimally as possible. We offer vaccines in our office. People do it. My personal belief on vaccines is people should be forced to do it. That's just my personal belief. But we have lots of people in the office that do the regular schedule. Some do a slow schedule. But we still have conversations, and I just don't force people to do anything. And so that's kind of how I got my start in integrative medicine. And over the years, and what's really, I guess, got me on more stuff lately is just talking about vaccines, because it is such a controversial topic. It's something you really could talk about for so long. But you realize when you're in integrative medicine and seeing families that are a little bit more holistic minded, that they have a lot of questions about vaccines. And I realized very quickly that I had not learned a lot of the things that people were asking me. I didn't know the answers. We learned in med school and residency, like, okay, here are the horrible diseases, here how much better they are now, here's your schedule, go do it, great. And that's most of what we learned. We didn't talk a lot about the science and the research and the studies. And so I had to really learn that myself, and I got really frustrated that you couldn't really talk about it online. And ultimately I decided to write a book, which came out this year, Between a Shot and a Hard Place. And even when I was writing the book, I was really scared that I was going to get, kicked off social media, maybe have trouble with my license, all those kind of things. And it's been really positive to see that people are so open to it. And I don't tell people not to vaccinate ever. I've never said that before. But I do think there are a lot of questions that parents have, and a lot of reasonable questions. And I think that we should be able to have discussions on vaccines, on chronic disease, on all sorts of issues, because we do have a big problem, like you mentioned. Like, kids are sick. About 50% of kids have a chronic disease, about 75% of adults. That wasn't that way 20 or 50 years ago. So we have to have a little humility in medicine to think that we're not doing everything right. Like, not everyone's dying at 40 anymore, right? So we've done some good stuff in medicine, but we're maybe not as good with chronic disease. And I think that's something we need to have a little humility and say, okay, well, what are we doing different in the last 20 or 30 years? Where can we adjust things? What do we need to do moving forward? We want to live longer. We don't want to have infectious disease, but we also don't want chronic disease.
That's really good context and background, and I'm really curious and interested in having this conversation, given how you've come about it, right? And just so you know, Dr. Warsh, at the group of doctors that I work with at Baker Health, it's not dissimilar. We're on opposite coasts, but just so you know, our doctors train at like top universities. They have academic appointments. They're kind of the types of guys and gals that you and I looked up to in traditional healthcare. But we don't allow someone to work at Baker Health if they don't have a certification in at least one certification in lifestyle medicine. So emphasis on sleep, nutrition, how to treat back pain without surgery. Our offices have yoga studios and Pilates classes in them. We have nutritionists and therapists side by side in the offices. And so we've gone to great lengths after studying Eastern medicine. My brother and I did that for a year. We studied it and then brought it into this practice. And this experiment that is Baker Health, we've been doing for just over 3 years. And it's interesting what you're saying, because I think it took doctors a while to be pulled by for lack of a better term, market forces. And what I mean by that is, 10 years ago, as recently as 10 years ago, the average American patient just went to their doctor. And if you went to the average American patient and said, you got to use yoga for back pain, and instead of getting an Ambien to sleep, let's talk about sleep hygiene and, wind down periods and breathing and meditation, you wouldn't have a patient to take care of. You wouldn't have a practice to build. And in the past 10 years or so, there's been this seismic shift where what was more fringe or crunchy or whatever you want to call it is now very mainstream. And it's not an overstatement to say that the average American patient today, the average American patient is seeking more functional, holistic remedies and advice in general, just day to day. And I think the majority of people are developing this dual doctor relationship. They have their doctor when they need a Z-Pack or they have a headache, and that relationship is dwindling, frankly. And then they're all reaching for a longevity doctor, and it doesn't have to be a human. It might be their Aura Ring or their Fitbit. It might be a functional doctor or practitioner that focuses on gut health, because they get laughed out of the office when they say, my joints hurt and the medicine you gave me, Dr. Smith, doesn't work. So they find someone who says, well, have you tried elimination of gluten? Even though I know your celiac panel is negative, that doesn't necessarily mean you won't benefit from an elimination diet or whatever. And all of a sudden, where do we find ourselves? The average American patient has 2 or 3 or 4 different doctor relationships between wearables, between a functional person, online, and then their traditional doctor. And so there's more information than ever. I think we're in this embryonic phase where now it's time for us to take all this information, and I don't want to say to consolidate it, but find an elegant way to make it not a bunch of contradictory noise and chaos that only furthers confusion, but to distill it and say, here's the right holistic, functional, Eastern medicine stuff. And yes, when your child has pneumonia and they can't breathe, they need antibiotics, right? But it's also true that most of the kids that come into the office on medicine don't need it. Both of those things can be true, right? And so I think where I'd like to start with the questions, and again, I think your background's awesome, and the content, anybody who hasn't seen your content, I think if they have an open heart, open mind, should check it out. I'd like to start, and this is pretty apropos, just in the past day or two, the CDC has come out, as you well know, and this is, the prevailing governing body for all things, including vaccines, and has come out and said that we cannot rule out a link between vaccines and autism. And this is a massive departure from kind of, the traditional stance that's been taken. Obviously, I'm not a political guy. I don't know about you. I'm not very political, but there's obviously a ton of politics around this. I'd rather just focus on what it means to the doctor and the patient as a result of this. So now for the first time, you have patients being able to point at what is considered a credible body, right? It's not just a mommy Facebook group, but a credible body that has scientists on its boards and committees saying we cannot rule out a link between autism and vaccines. What's your perspective on that decision, by the CDC? And I understand your position on being open-minded with parents, but I want to start the conversation there because I want to go towards, is there a tipping point, Dr. Warsh, where our openness can lead to, an outbreak or some kind of epidemic? So let's start there.
Yeah. Well, I mean, I'll definitely go through my position. I'm curious where you're coming from. Like, I'm curious what, even before I answer, like, how has your understanding of vaccines and the autism debate evolved? Is it evolved? Do you agree with that change, or you disagree? And have, like, how much have you looked into that research personally? I'm just very curious, even if it's like very short, like where are you on that scale? And then I'll run through kind of my evolution.
And I appreciate the curiosity. I personally think that a statement like that, I could see why some people would say it's important and it's a step in the right direction. But when I do my societal math, I think it's a mistake. And the reason I think it's a mistake is we could say that about many things besides vaccines that are non-medical, and many things that are endorsed by the CDC that are medical. But to go out and say that is to really kind of plant a wedge in there. I do think there's other ways we could accomplish the same goal. Meaning, if the goal is to have us as a medical community be a little bit less heretical as we were in COVID and telling people what to do and pretending we have all the answers when we don't, but while acknowledging that there's a benefit to vaccines and they've had a huge impact on society, I think there was probably a more light touch way to do it than spark this controversy. I don't have all the answers, but that's my humble perspective on this. And then maybe...
Can I ask you a specific question? No, that's a perfect answer. And I'm just curious, do you think the science on vaccines and autism is strong enough to say that it's settled or that the link has been debunked? Not what the CDC said. Do you think that because you hear that all the time, right? I mean, that's something that I learned in training, and you hear all the time, and you watch the news or whatever, and like, oh, the science is settled, it's been debunked. Based on your understanding before 2 days ago, do you think that's true or not true?
My answer is this. I don't believe the term "the science is settled" has any place in science. There's been meds that when we took pharmacology in school, you and I, like statins and blood thinners that were I mean, doctors would say it should be, like treated like salt in every American's diet, that then get recalled at a mass level. Stuff that we're told is 100% necessary. So there's no, in my mind, there's no such thing as science is settled when you and I know 30% of what we learn when we graduate medical school 3 years later is null and void and no longer the standard of care. And here's what I would say on that. I think vaccines have been studied. Much of the methodology of how vaccines has been studied is flawed. That's largely a function of many things, but one of them is it's hard to have a control group and, with kids, when you think something's going to be able to affect them, and get someone to sign up and say, hey, I think this is going to prevent your kid from having polio in the 80s, but we're going to put you in the control group. So we could debate how well the techniques of those studies are, but vaccines have been studied, right? And I think that we've seen a marked decrease in many of the diseases that vaccines do prevent. There's other reasons for that, but I think vaccines are a major reason for that. You and I have both seen 3-week-olds with whooping cough that are intubated in the ICU. And when you see that, it's hard to take for granted, what vaccines do. The last thing I'll say, and then I'd give it back to you, is any medicine that has a positive impact by definition has a potential side effect, right? We know that if it can help you, it can hurt you. And if it can't hurt you, it probably can't help you. Do I think that there's multifactorial characteristics both to some of the diseases we're seeing that could be triggered by a virus or by some insult or by an immunogenic reaction that could be triggered? Sure, I think that's possible. I don't think they're without potential side effects or negative impact, but I think probably in aggregate, I'm one of those guys, when it's all said and done, that does think it's one of the greatest accomplishments we've had in the 20th century. I think we should have conversations around it. I think many vaccines are not as effective as others. I think some have more side effects than others. And I think we should perpetually be having conversations and questioning the present orthodoxy.
Yeah, I will go through, kind of my evolution, but I would just say, but even before I do that, I think if most doctors took the approach that you took and answered in the way that you answered, we'd be a lot farther, I think, with patients, and I think there'd be a lot more trust, because I think your answer's super reasonable, and I agree with basically everything that you said. For me, I think it's really interesting because, as I said, and as I think you would be the same, and almost all doctors, like we're kind of taught when we're in training that there's no link, right? That the science is settled. We have such strong science. The CDC website kind of said that. You're like, no. Here are the studies. We have tons of studies. We've done tons of research. We absolutely know vaccines don't cause autism. And that's really what I thought for very long. And even when I went in to write the book and I wrote that chapter, I would say for sure, by far, the most surprising thing to me was the vaccine autism literature when I actually looked at it myself. Because what I thought when I was going to write the book was going to be, obviously I take care of people that are more hesitant. I have seen things in the other world. And so I was aware that there are certainly some things out there that discuss vaccines and autism and have a different opinion on the science is settled. So what I thought I was going to find was, this plethora of research, really great studies, vaccinated versus unvaccinated, all the vaccines, and really good data to show vaccines don't cause autism, right? And that would be very strong. And then there would also be some other stuff that maybe was like, well, maybe it's a little bit related. Maybe some studies that are not as good or smaller have kind of shown that in the past. And like, here's why medicine says vaccines don't cause autism. And then here's the other research. And like, I think you need to understand where their side is coming from, because it's not completely on one side, but like the majority of it really shows that. And when you go look at the research, it actually isn't that strong, I would say, in terms of what I would consider really, really strong evidence as someone who's done a master's in epidemiology. Like, I was very, very surprised. The research really mostly has just been on MMR and thimerosal. Thimerosal is not really in vaccines anymore. That's the mercury component. And so most of that research is not super important anymore. And then you have the MMR studies. And most of the MMR studies were MMR versus no MMR in the setting of getting your other vaccines. And so there aren't vaccinated versus unvaccinated trials. There aren't studies on all the rest of the vaccines, which there are a lot of them that you get in the first year before MMR. And so to say something like vaccines have been proven not to cause autism, like that when you look at that research, it just doesn't make sense. And I thought I was missing something. Like I didn't understand it. I thought for sure I wasn't finding things. Then I had to stop. I had to go read Paul Offit's book and Peter Hotez's book and all these other books that are, I would say, super pro-vaccine individuals. And they cited the same research. And so the more you really dig into it and you read about it, the more you realize that really the science is not settled. And then you go listen to like Aaron Seary, testimony, who's a lawyer who does the vaccine research, and they've sued HHS and other places to kind of get to see if there is more research. And really the argument really does boil down to the fact that the research hasn't proven that vaccines cause autism. So most of the research doesn't show a link. That's very true. But it also is also true that a lot of it hasn't actually been studied. And so to me, the correct answer really should be, we don't know. We need to get more research. And I think that really should be where it may very well ultimately be that vaccines have nothing to do with autism, or maybe it contributes in some way in a certain subsect or genetics that it kind of pushes kids over the edge. I don't know the answer to that. And that's what we should be studying. But to me, I was so shocked when I actually looked at that, because it really is not that definitive. So the reality of this change on the CDC website, from what I can see, it is mostly accurate. I mean, it really is. They're basically saying vaccines have not, it's a double negative. It's like vaccines have not been proven to cause autism, which is a weird way of saying it. But I think basically they're saying it hasn't been proven. We don't know. We still need to study it. Do I think that was a good way to go about it? Absolutely not. Just to change the CDC website and kind of not even say anything, and it just is that way. Like that to me was not the right way. If I was doing it, I think the best way would have been to call together a new panel, like a new, Institute of Medicine or something, and say, all right, like we need a new literature review. We want to have a diverse array of opinions. We want people like the Paul Offits on there, and then we want people on the very other side, and everyone needs to sit down on a table and let's draft up. Let's go through the research. Let's show what let's show what it does and doesn't show. Let's do a literature review. Let's put in the New England Journal of Medicine or whatever, and then disseminate that to doctors, so that way they can see what the literature does and does not show, so we can move forward. Like, to me, that's the right way, as opposed to just, vaccines haven't been proven. Like here's a change in the CDC website. That's just not super helpful for doctors. So that's kind of my position on it. I don't think that vaccines have in any way been proven to cause autism, but I do think that they certainly haven't been disproven, and we do need that research. And what should have come, in my opinion, what should have come out of the HHS, which I thought was crazy, was kind of the way that Kennedy approached it, in terms of, we're going to have the answer by September kind of thing. And what should have been done in that situation was, all right, they did some background research. They did a good literature review. Here are the things that look like they might be associated with autism. All right, here are the 20 things that seem by the literature to be most related to autism. We're going to put a lot of money over the next 10 years to do studies, to look into this, to figure out what might be contributing. We know there's a genetic component, but okay, what are the environmental factors that are most likely to be associated? And let's see if we can figure out some of those things and adjust it. Like, that would have been the appropriate way forward in terms of science. And it's not anti-vaccine or anti-anything. Like, if vaccines do contribute to autism, we should know that. We should learn that, and then we should figure out why. Maybe there's an ingredient in there. Maybe there's something to do with the schedule. I don't know, but that doesn't mean you don't have to do vaccines. That means you could alter it or change it. You could make it better. We've changed vaccines before. Or you do prospective studies. You do vaccinated versus unvaccinated trials. You do 10 of those around the world. None of them show any connection to autism. And then you have the actual science that you would need to say, look, we've done 10 studies, vaccinated versus unvaccinated. We've followed kids for 10 years. There's no difference. To me, that's the research that parents would want to feel more comfortable. And then you would have a bridge, a bond, an understanding, and you'd give people the proof that they're actually looking for. I don't see anything wrong with it. That's science.
Yeah, I think in a perfect world, what you're saying in terms of being the ones who provide the answers, the medical community would be ideal. I think, until someone can come out and point to what definitively does cause autism, and more specifically, this rapid rise in autism, it's impossible to say this batch of whatever doesn't. right? And that's the paradigm. And Dr. Warsh, I really, with your background, your extensive, because you've done more reading and research, and you've published now a book, and you've obviously done a lot more digging into this than the average pediatrician. And like you said, when we come out of school, it's very cursory. Like it's like, hey, here's the macro data, right? And so, given your background, I want to push you a little bit in the most respectful way possible. And what I want to do is ask a couple of questions or point out a couple of statistics. The way when I have this conversation, and I'm sure when you have this conversation, not on air, like with colleagues, with folks you went to school, trained with, consultants you work with, this is kind of off camera, kind of the because look, also within the pediatric community, there's not a lot of doctors that are 10 out of 10 on it and 0 out of 0. There are, don't get me wrong. I speak to doctors that are super dogmatic, and they're like, well, you can't ever have this conversation out loud. And by the way, it's not that they're dogmatic internally, but they think it's important to be very absolutist externally, out of fear that if you and I have questions, then of course the patient's going to have questions, right? And I think that's disingenuous. That's completely, in my opinion, that's disingenuous. And so I think most folks are somewhere in the 8 out of 10. Look, I'm very sure vaccines are not the cause, but I'm not God and I don't know. And maybe 4 out of 10 that, hey, I think maybe we should, take a step back on how many, that kind of stuff, or the ones that are not as effective. And so with your background, I want to ask you a couple of questions. We know that when it comes to autism, monozygotic twins, right? So for those that are listening, shows a higher propensity of autism than the general population. Also, we know male to female is like 4 to 5 to 1, right? 4 point something to 1. And I see this in private practice. I'm sure you do. These things do flesh out, right? Can you respond when you're confronted with these kinds of statistics that are valid, right? And I know there's a lot of nuance to it. Can you give me your position when you hear those?
Yeah, I don't think there's any question that there's a highly genetic component to autism. I don't think that that's in doubt in any way, and certainly is borne out in all the statistics and the studies that do look at genetics. I think it was like 80% for twins. So it's there is a massive component for that, but at the same time, we have a massive increase in autism over the last few decades, and that can't be just genetic. I mean, there's no question that part of it is we're better diagnosis, we're more aware of it. A lot of people that were not diagnosed with it are, but I still think that's a very small proportion compared to the steep rise in autism that we've seen, and certainly the much more severe autism. I mean, you could just point to California, where I am. It's 1 in 12.5 boys with autism now, and there's not 1 in 12 adults with autism. Like, that's insane. Like, that's just not how it is. So sure, a part of it is, and certainly the more more mild high functioning autism is probably a lot of those individuals were not diagnosed, but that's not what's going on. We have a steep increase. So to me, it has to be two things. I think it's genetics and environment, and maybe and probably there are genetic factors that make you much more susceptible to it, but then there have to be environmental factors on top of that that push people over the edge or move you into what we call autism. And that's why I think autism is many things. I think it's a diagnosis, but it's probably many things. For many, it may just be totally genetic, just like cystic fibrosis, right? It doesn't you have the genes, you have it. For other people, I think it's an environmental trigger, whether that's vaccines or chemicals or a bunch of who knows. Like that's what we need to figure out. But to me, it's the genetics mixed with the environment. And so if you do think that it is vaccines, let's say, that cause autism, then I think you have susceptible kids, and for whatever reason, with those genetics, we're at that point where now vaccines are throwing you over the edge. Maybe it's all the other chemicals and toxins plus vaccines. Maybe we have a lot more vaccines than we used to have. Maybe they're different than they used to be. I don't know what the answer is, even if it is related. But I think that you can't just say it's genetics, because that doesn't really make a lot of sense. It's the same thing as chronic disease. Like, I don't think you can say that chronic disease increases just genetic. We just have an increase. We have an increase in cancer and autoimmune conditions and diabetes and everything, right? Everything is skyrocketing obesity, and that's not genetics. I mean, some people are going to obviously be more susceptible to having a problem if they eat the same food. Like, we know that, but me and you could eat the exact same food and I can get diabetes and you don't. Like, that's just how genetics work. So I think it's a mixture, but I believe we're just getting to the point that our world is so toxic that everyone cannot handle, or so many people cannot handle just the daily toxins that we're exposed to. And then vaccines, because we're getting so many more, could throw some people over the edge. Maybe there's a certain genetics, maybe prematurity. All these things could play into it. Maybe, I don't know. That's what we should be studying. That's the question, right? The question really from parents, I think, that are in that world that have concerns are: is my vaccinated kid going to be less healthy than my unvaccinated kid? Like, is there a difference in health? I think that's the question, right? It's not if I get a couple, it's if I don't give any vaccines to my kid, are they going to be healthier? And you can be sure as a pediatrician that you're going to not be protected as much from some of these diseases, but two things can be true. You can have more protection against whooping cough, but you can also have an increased risk to get something else if it causes a side effect. So that to me is the question. And it's not about vaccinating or not vaccinating. It's about maximizing the benefits and minimizing the risks. And I think a lot of discussion when it comes to especially pediatricians and pediatrics, especially the dogmatic ones, it's always about, well, do you want kids to die? Do you want kids to get measles? We know vaccines work. And I don't think that, I think very, very few people question whether a vaccine works. There certainly are some, but the majority of people are somewhere in the middle, and they know that the vaccine works. They've just decided that they don't feel like the benefit from the vaccine necessarily outweighs the risks, especially today where we just don't see a lot of these diseases. I mean, yes, like you said, like me and you, we've seen people with RSV in the hospital. We've seen people with whooping cough. We know people have died this year from measles. So we know that can happen. A lot of parents haven't necessarily seen those, but even if you can die from whooping cough, the question still becomes, well, yes, you get some protection from the whooping cough, but at what cost? And I think that's a reasonable question to ask. It's not unreasonable. That's the right question, because ultimately, if you were to prove that, let's say, the DTaP vaccine causes more problems than it helps, that doesn't mean that you don't want protection from whooping cough, but it does mean, well, maybe we need to make a better vaccine that has fewer side effects. Like that could be possible. We've done that before. We changed DTP to DTaP because it was causing too many side effects, so we made a better one. Maybe we need another one. Like maybe we don't need to give every kid the diphtheria vaccine anymore. Maybe every 2-month-old doesn't need polio anymore, vaccine. Like maybe you could do that later. Like there are different things that we could discuss and debate. It's not all or none. I think there's a lot of nuance and middle ground that is completely reasonable to have and should be discussed and debated, because more isn't always better. And that's what it seems like right now. It's just more vaccines. And at some point, it's obviously too many. Like you can't just inject aluminum forever. Like at some point it's too much, right? And you could say, oh, it's a very, very small. Okay, that's true. But eventually it's going to cause a problem. So we have to have debates about what's most beneficial with the least harm.
That's useful, and I really appreciate the perspective. I do want to segue into some other areas that are related to holistic health from a pediatric perspective. And again, with your background, I didn't know that about your wife, by the way. So it's a household thing with you, and so I'm really curious on some other aspects. And we could kind of segue to when we talk about, well, there's likely environmental triggers out there, combining with like epigenetics and so on. Can you talk a little bit about something like gut health is something that's become a bit fatty, right? It's come into it's a bit of a trend in the past few years. And it's one of those situations where I'm a big believer in it. I think it's greatly misunderstood and undervalued. I also think at the same time, a lot of the reports that patients will bring me from whatever commercial product comes in and it shows the yeast is 0.1 higher in this part of the gut and it's pretty uninterpretable, and they're left there with their palms facing up asking me for answers. And I think we're in one of those no man's land where gut health is really important. We need to understand it a lot better. I don't think we understand it as well as we should. We know a lot of basics about diet, nutrition, and so on that we should overemphasize. But I'm curious, with your depth of research in this realm, what's your view on gut health? And then also other aspects of environment, diet, exercise that you have a unique perspective on that you think is commonly overlooked as it pertains to kids?
Yeah, I think we totally agree on that perspective. Everything you said, I would 100% agree with. Gut health is, of course, important. I mean, gut health is a term that's kind of used now, I think, more functionally and in functional medicine, because then there's some tests and other things you can do and supplements. But just from a very basic perspective, just taking, outside of medicine, like obviously the food we eat is important, right? We're literally built of what we eat. And the food that we're eating in general is so crappy now. I mean, just from the very most basics, like most of the food that kids are eating these days is ultra processed. So 60 to 70% by latest research is ultra processed food. And so that is devoid of nutrients and filled with all sorts of chemicals. And we understand this for a plant, or we understand it for a fish. Like if you put a bunch of chemicals in a fish bowl, you can give them all the vaccines, the medication that you want. But if there's a bunch of chemicals in there, they're not going to survive. Like you need clean water, and you have to give them good food. And if you give them crappy food, they're going to die, right? And that is what's happening in our world. We're so surrounded by chemicals, and our food is so crappy, and it's not fresh, and it's not local, and we're not preparing food as much as we need to. And so our gut health, our just general health is struggling. We have more calories. We have enough calories that people are not dying of malnutrition anymore, but the calories are just not nutritious calories like they need to be and they once were. And I think that is the biggest driver to me, in my opinion, of chronic disease, that we're just not getting the food that we need. And we understand it with diabetes, right? And that's what's so weird to me, is the concept with diabetes is so obvious to doctors. It's something we've been talking about for so long. You have type 1 and type 2. And we understand that there's a huge component for type 1, diabetes, obviously. And then for type 2, it's very environmental. And we say, okay, well, if you have type 2 diabetes, all right, well, just change up your food, eat healthier, exercise, and then we see it go away. I think a lot of chronic diseases like that. I think there are many conditions where we assume it's all genetic, and for some people it is, but I think for a lot of people it's also very environmental. And the food that we're eating, if we're not giving our body what it needs, then your immune system goes haywire, and it leads to other issues. So yeah, I think gut health is super important. I think we're still at the very beginning stages of understanding it. The gut is extremely complicated, and it's really hard to take a test and then be like, oh, well, this is off, so therefore you can do this, this, and this. I mean, I think sometimes it's useful to look, certainly for people that are sick, very, very ill, chronic illness, then it can be helpful to have a look, get some information. Some information can be better than none. You can try to do things with that based on what it is. Because sometimes you could find a parasite, you could find an infection, you could find things that are very obvious. The more subtle things, like you said, like, oh, a little yeast elevated, like you don't always know what to do with that, because just because you find something doesn't even mean that's an issue, right? It's just like doing a full body MRI, on back scans and things like that. And it's like, well, if you look, and the research is like 60-70% of people, you're going to find something, even though they have no problems, right? So I think that's the same thing when you're going to do a shotgun approach to testing. You're going to find things that aren't necessarily related to anything. And most tests are not even really studied in kids. So sometimes it's even hard to know what to do with it. But ultimately, for me, the main focus has to be back to those basics: eating healthy and moving, and getting good sleep, and trying to minimize your toxins. And for most integrative practitioners, I mean, basically everyone I've ever talked to, they always point to food as the number one thing that you could do. And if we can read more labels and focus back on those basics, I think that's going to get you the most bang for your buck over anything else, over any functional testing, over any of that stuff, because a lot of that is helpful, but not always. But changing up your diet is pretty much always going to be helpful if you can figure out what works for you.
And I want to piggyback on that and ask just some very rapid fire, kind of direct, practical questions for the audience. So kid comes in, and you and I have seen this a million times: chronic abdominal pain. We've worked them up. We've done the tests. We've checked the stool. Nothing identifiable, but the mom will then say, yeah, I noticed if we go to the movie theater and he eats, movie theater food, whatever, that kind of thing. So someone where, it's kind of like some GI functional abdominal pain, and give me 2-3 things you tell the family: listen, increase this, stop this in Jimmy, who's 8 years old with, intermittent functional abdominal pain.
Yeah, the thing that seems to help the most for functional abdominal pain is making the parents aware of being conscious. So writing things down, starting to think about what they're doing before and after, especially with food. So I think that seems to be the most helpful. Is you can point out, like, okay, gluten, dairy, the things that are most common, but it could be anything. But pointing those things out, and then writing down, okay, you had a stomachache today. What did you do? What did you eat? Where did you go? A lot of times being that detective can be really helpful, because sometimes they can figure out a pattern. And that would be really helpful. For the older kids, I think stress and anxiety, that's another thing that, if you've really done the workup and you can't find anything, if they're a more anxious, stressed kid, then sometimes just even bringing that up to the parents and talking about it, then having them see someone can also be helpful, because sometimes that's just very simply, like anxiety, stress, that they're having their stomach issues. So I always try, we try to work it up first. But if it's nothing else and you can't find anything and it just kind of comes and goes, then that is something also to consider. So those are the two big ones. But I would say the food diary is really the most helpful in the short term, and it's free and anybody could do it.
That's sensible. That's similar to the approach I take. And you've been very generous with your time. And with this last bit of the conversation, the last topic I kind of want to talk about is a topic, Dr. Warsh, that I think encapsulates everything we've discussed, which is medical education. And I don't mean just medical education for the next generation of me and you, right? Like we teach, I'm sure you're involved, like we teach med students and residents, a couple of our doctors are directors of actually residency programs and faculty. I'm taping this in our office where we have 2 med students right down the hall watching us tape. These are the future, right? And they're watching us and listening to our conversations. That's half of my question. The other half of my question is medical education for the average American citizen, meaning how should they go about? There's a lot of distrust in folks like me and you. They're turning to Instagram and TikTok, maybe for 30% of the information. They're turning to their wearable for another 30% of their information. They go to a guy like me or you for 30%. And then 10% is, their cousin Susie or whoever, who, swears that she used to have migraines. And then when she started having, whatever it is, alkalinized water and some lemon, it stopped. And that's the medical education that the average American consumer is consuming. And that goes to where this conversation started. In many ways, it's great. There's more resources than ever, and there's more information than ever, but there's also more chaos and confusion than ever. And frankly, there's more nonsense than ever. So there might be more good information than ever, but there's also more nonsense than ever. And I'd like you to maybe spend a few minutes, if you don't mind, talking about that we do have a lot of young doctors and nurse practitioners and healthcare folks that listen to us. Actually, we get a lot of feedback from them, and talk a little bit about that part of medical education, and then kind of as the healthcare patient or consumer.
Yeah, beautiful questions, and the change is going to have to come from the young doctors. The older doctors, hard to change, and medicine is very notoriously slow to change. But ultimately, the world is changing really fast, and I think it's going to be up to us to either decide that we're going to, get with the program or become, more obsolete, especially with AI and those technologies coming up and becoming more and more, I would say, useful and actually pretty good at helping people. We're going to make ourselves obsolete if we don't start listening. And the biggest value that a doctor brings is that interpersonal relationship, I would say. And that's why I think, any futuristic show you see, there's always doctors there, right? Even when they have all the technology, we're still the stewards of that technology, and people, they're not just going to a robot, but they're going to a doctor who has their, magic wand thing that works you up. So I think that we have to have a little bit of humility, go back to the drawing board, partner up with parents again, start listening again. And that does start with training. And I think we're going to have to include more of that in that training for people to start to respect that doctors actually care about preventative care. And it doesn't, I know that they do, right? I know that no doctor wants anybody to be sick, but the system is just really not set up anymore or at all to focus on prevention. You don't have enough time. You don't have the resources, and we don't have the training. We don't have the nutrition training, and we're not going to be a nutritionist, and that's fine. We don't have to be, but I do think we can get more training in some of these things. We can get training in these discussions, and we can certainly get training and an understanding of what some of these other practitioners do a little better, so that way we can focus more on working with them. And I think that ultimately will be where things can go, that we're able to work with more practitioners and partner up. And that's what, I think practices like yours do. And certainly at mine does as well. I have a better understanding of chiropractors and a better understanding of acupuncturists. And I don't do it, right? And I don't send everybody to them, but I at least understand what they do and understand where they can be helpful and recognize my limitations. And I don't think doctors are always so good at that. And maybe everybody needs a nutritionist. Maybe that's part of it. Maybe you come in, you see your nutritionist for 20 minutes before you see your doctor. Like, you don't have to spend an hour with everybody. But if we acknowledge as a group of doctors, like if all of us banded together and say, look, medical system's not working for kids, we're really sick, we need to change it. Like, insurance has to change it. We are demanding that everybody gets covered a 20-minute nutrition consult every year. And that should be a part of insurance. And we're not working until that happens. Like, it would change overnight because, doctors kind of run the system and really are the ones in power. But it doesn't seem like we ever band together and work together. It's very disparate, and everyone's kind of doing their own thing because they're so busy and tired. And just, really right now, doctors are just not very popular. And that wasn't the way that it was. Like, doctors were the most respected, one of the most respected. It was like us and firemen, right? Back in the day. And now doctors are at the bottom. And we can bring that back by partnering back up with patients and doing things that really do benefit patients, and banding together, and not from a dogmatic place. Like right now, it just seems like the dogma is you got to get your vaccines, get more vaccines. Like that's what you have to do. And that's not what people are looking for right now. I think they're looking to partner up, and they're seeing chronic disease rates skyrocket. And to me, they want to see that we care, and that we care about even the side effects from vaccines. Like, we're not saying that you shouldn't get a vaccine or that they're bad, but we hear you, and we understand that they could happen sometimes, and we want to examine that. We want to make them safer in the future, and we're going to study that. And we're not going to say that you shouldn't do it, but we are going to say we acknowledge that we're hearing the stories of parents that they say their kid, was normal today and was not at the day after vaccines, and we're not going to dismiss that, but we're going to look into it, and we're going to see if we can make it better, or decrease that, or improve it. I think all those things would go a long way. And I think if we start that training early, and get that in people's minds, and just a reminder to doctors, like, hey, pharma is not necessarily on our side. Not all of medicine is bad, right? Obviously, not all of pharma is bad. There are a lot of great medications, but maybe we need to, make the joke, like maybe we need a little bit of why not to trust pharma 101 for doctors. Like, we're not necessarily on the same team as pharmaceutical companies. Like, we use their products, but we also need to keep in mind that they do lots of stuff that is not that good. And so, ultimately, we're not on the same team as them. We're on the same team as the patients, I think. And maybe we need to push back on pharma a little bit and require a little bit more of them. And I think if people saw that, and kind of us partnering with them, that would help to rebuild that bond. So that's my kind of answer to the first question in terms of training. And what was the second one again?
The second one is, how should the average American consumer look at their journey of medical education, right? This used to not be a topic.
Yeah.
It used to be, I have a doctor. What kind of question is that?
Yeah. I think that's true of everything now. I mean, parenting and medicine is very difficult because there's so many voices, and there's so much noise, and there really is no, I think, simple answer to that, because there's just so much information out there. But ultimately, I think you need to try to follow individuals that seem like they're being honest, that are willing to say when they're wrong. Don't People that are making wild and crazy claims, that are very dogmatic about things. That's usually not the best when it comes to science, because usually science is somewhere in the middle, and oftentimes we don't have the full answers to everything very definitively. So someone's very definitive, that should be a red flag. But I think, even when I talk for just parenting things, I think that what's important is to trust your gut and to take in multiple different opinions. Don't just listen to one thing. And I said this, on my book, Vaccines, like, a perfect example. Don't just read a Paul Offit book. I think you should read a Paul Offit book, but don't just read that. Read that book. Read another book that is maybe more anti, or more questioning, and get both perspectives if you want to learn about it, and then land somewhere in the middle. But at least you have the understanding of both sides, and you can still do the CDC schedule. That's fine. I think you should know the CDC schedule. You should know what Paul Offit and individuals like that have to say, because these are people who have been doing it for 40 and 50 years, and they have your best interest at heart. Even if for the people that don't agree with them, that's okay. But there are a lot of smart people who have been working on a lot of these things for a long time. So to me, it's getting multiple opinions, and trying to synthesize those down, and then doing what you feel is best. You trusting your gut. I think that's the only way to go forward right now. There's no one simple way to know exactly who to trust or what to trust. You have to, I think you figure that out over time by following people and listening to people, and hopefully you can find a practitioner that you trust. And if you can't have conversations, they're not even open to talking with you, then that's maybe not the right practitioner for you. So hopefully you can find someone that you can at least respect and trust, and have discussions with, and bring your questions to. And that to me is the best way forward for now, because there's no easy way. I mean, maybe AI is going to be more helpful for that, but even that, it has its limitations, a lot of limitations, and it's limited to what information goes in there and who sets the information. So there's no one exact answer. And I don't think AI is the answer, but I think it can be helpful in a lot of ways if it's used appropriately. So hopefully we we will use it appropriately and it doesn't, try to murder us all.
Yeah, I think this was a great conversation. I love your kind of fresh perspective on things. I'd love to do it again, and you were very gracious with your time. And even maybe next time we'll pick up kind of where you left off, like the comments on how doctors, quote, have the power and we are the system and we've given it up. I think I'd love to have a deep conversation with you on how we've drifted so far out of it, how, the Apple Watch and, Google and ChatGPT and, Facebook groups have completely dominated us in terms of, credible resources for the average American consumer, and how at best many times the American doctor is a third opinion to start. Whereas just one generation ago, we were the first, second, and third opinion. And what happened? And maybe the hard question is, what did we do wrong? And I think that's not what when you hear people talk about doctors being displaced, what happens is there's finger pointing. Oh, because of technology. Oh, because of social media. I would say first and foremost, it's because of us. We ceded that ground.
I agree.
And I think
I said that very specifically. I said it very specifically in the book. I said, you got to point a finger in the mirror and then look at the fingers pointed back at you. It's like we did it. I think doctors did it. And I think we put the nail in the coffin during COVID. And when you are not honest with people, trust is hard to get back. And there is no question that the remaining trust in medicine was destroyed during the pandemic. I mean, we saw that very clearly, and we're still seeing it now. And now people just trust nothing. And unless there's some honesty that's brought back into medicine and some humility, then that trust is gone, because there's a lot of other options now. That there was no option back in the day. Like you had to go to the library and do a decimal system and pull out a book and go read it, and then you didn't understand what you were reading. Like, that's a lot of work. Now you can just Google, like, all right, well, here are my symptoms. What should I do? And the internet will tell you. And so you don't need your doctor anymore. Like, your doctor is not the internet. They know certain things, and obviously the internet's always going to give you perfect information, but you can get information now without having any knowledge. That was not the case before. So the doctors have to build back that relationship and that trust, and the honesty needs to come back, and it's gone. And now, I mean, more than that, just to finish up, now we have this back and forth debate between HHS, Secretary Kennedy, physicians, American Academy of Pediatrics suing. It's like that doesn't help. This is not helping. It's like I think both sides are right and both sides are wrong, and there are things that they're bringing up that are both very useful. But unless everybody sits down at the table and starts to have these discussions, it's just making parents more confused and frustrating and tuning it all out, because you're like, you see that the AAP says vaccines don't cause autism, and then the website gets changed and the CDC say it maybe, and don't trust the CDC anymore. They don't know what they're talking about. And it's like, okay, well, I'm just going to not listen to anything. All right. Like, that is not going to work. Like, everyone needs to get back on the same page. And I know that's not easy, but I do think that is possible with conversation and honest debate and discussion. And we're not doing that right now. I mean, even this last message, it's like, just to change the website, that's insanity. Like, just to change it with saying nothing, not having a discussion, just the CDC, whoever, in the background just decided to change the webpage. That's how you make that announcement. That's not helpful for the average parent. That's like, okay, what do I do now? Like, do vaccines cause autism? Do I give my kid a vaccine? Like, what, the CDC website says this. What do I do? My doctor says, no, they don't. And then you go read something else and you're like, well, it's not been studied. Okay, what do you trust? How do you know who to trust? It's impossible. That is not good medicine. We're destroying credibility, I think.
Yeah, I think I'd love to talk to you again about the crisis, right? Getting away from the actual science, like we discussed today, kind of the science around vaccines and emotions, but talking a little bit about the plight of the, American doctor, the healthcare system, and where it leaves the patient. But you've been so generous with the time today. This was a lot of fun. I really look forward to talking to you again. And I would urge folks that haven't kind of heard you in other outlets, you're doing a lot of things, to check it out with an open heart and open mind, much in the way you kind of check things out. So thank you again, Dr. Warsh, for your time. This was great.
Thank you.
Have a nice day.